Time returns tomorrow to Fox 51.
Welcome back to Fox 51 today. When school starts up, you know what that means.
Oh, yeah.
You got to start getting your shots.
Yeah.
All sorts of shots you need to get. So today, tell us more about this is Amy. She's the pharmacy clinical manager with Trinity Mother Frances. Good morning.
Good morning.
Oh. Okay, now we were talking about a little bit earlier during the break. Unfortunately, when fall comes around, flu starts to come around as well. And you were saying now's a good time for kids to start getting their flu shots.
Yes, so one of the things we can predict about any flu season is that it's a little bit unpredictable, so it's important to be prepared before we get hit really hard with our flu shots. So next week, Mother Frances starts giving their flu shots, so you can go to any of their clinics and start getting flu vaccines there. They're also available at local pharmacies, so it's really important to get those flu shots when they're available.
Now, would you recommend the flu shot for all ages?
Well, now we have different flu shots that are appropriate for different age groups and different types of populations. So there are some choices out there. There's pediatric flu formulations that are appropriate for infants and toddlers. There's flu mist, which is a spray that we tend to use in small children. We have flu shots that have 4 strains instead of the traditional 3-strain flu shot that offer a wider amount of protection against flu strains. And then one of the most exciting things is the high-dose flu vaccine that we now offer our senior patients, which we know now from a big article in New England Journal of Medicine helps protect our seniors better from the flu.
Very interesting.
So it takes, I think we said, about 2 weeks for it to take effect. What are some of the issues? I know people say, well, you can get the flu if you get one. And we hear that. What are some of maybe misconceptions that people have about the shot?
Yeah, there's definitely a lot of facts and myths about flu. And probably the one I hear the most is you can get the flu from the flu shot, and that's absolutely not true. We generally don't give live vaccines to people who have, weak immune systems. And any of the flu shots that you get by injection are not active flu shots. So there's no way you can actually get the flu from those flu shots.
Now, say you do get one of these injections, maybe afterwards, could you start feeling a little groggy or anything like that after the shot?
Most people actually have no symptoms at all. The most common thing that people experience when they get a flu shot is a little tenderness at the injection site. And some people might feel a little bit of aches, but that actually means that your flu shot's working and that it's going to protect you from that severe illness that can land you in the hospital.
So as you said, it's unpredictable in general, but any different, I guess, can you have a heads up on maybe some of the different type strains that are maybe headed our way? Even, do they give any of that information?
Yeah, well, we know what the typical strains have been historically, and we haven't seen any activity that's really different from the last year. There are currently about 4 strains that are circulating throughout the United States. There's 2 types of flu A. One of those is the H1N1 type virus, and then we have a lot of, there's 2 strains of flu B, and we get a lot of flu B in our pediatric patients. But for our seniors, it's that flu A that really tends to cause most of the trouble.
Well, thank you so much for stopping by this morning, Amy. Well, coming up next year on Fox